A consequence of the outstanding improvement in patient survival in the field of myeloma is that median time to progression-free survival and overall survival are now longer than ever. And the expectation is that it will continue to improve and it will continue to be longer. While these are extraordinary news, it poses a challenge for the development of drugs and drug combinations, because the time to read out of a clinical trial will now take very, very long. And as patients continue to relapse and as we still have limited options in some countries and patient scenario, having fast drug development is paramount, continues to be paramount. This is the reason why, as a field, we are always looking for surrogates that can anticipate the readout of one clinical trial based on the most important endpoint, that is patient overall survival. So what can we do in between? Progression-free survival is probably the next best surrogate, but also median progression-free survival may now be 7 to 8 or 9 years or even more, for example, in transplant-eligible newly diagnosed myeloma. So the next possible surrogate is depth of response. And while considering depth of response, I think it has become clear in the field that the best measurement of the quality of the response is through the assessment of measurable residual disease, or MRD. This is why for a few years we have been working as a community to investigate if MRD can be used as a surrogate for progression-free and eventually overall survival. And in this study we are showing how, based on the published data of 15 randomized clinical trials in newly diagnosed, transplant-eligible, ineligible, as well as relapsed refractory myeloma patients, the differences in the MRD negative rates, whenever these MRD negative rates are being assessed with next generation technologies, either sequencing or flow, NGS or NGF, the correlation with PFS is moderate and, I would say, promising in all treatment scenarios. And therefore I hope that this study does help into setting up the criteria and guides on what will be the definitions of MRD endpoints for clinical trials. And this will definitely include, or it would definitely require the use of next generation methods. And it is my expectation, and you know I'm an optimist, that with more trials, 20, 30, and these will read out, many will read out soon, that correlation will continue to increase and will reach a number that everyone, including the regulatory agencies, feel comfortable and recognize that MRD could potentially be used as a surrogate.